Welcome to SCR Connection. Thank you everyone for joining us. It is my pleasure to introduce our guest speaker, Dr. Doris Ravotas. Dr. Ravotas teaches health literacy to future and present health providers at Western Michigan University in professional forums. She leads a health literacy program for refugees every summer. As a fellow for the Kalamazoo Literacy Center, she coordinates the health literacy work group in tutor forums and recently conducted a series on COVID-19 for literacy and English learners. She is presently on the Fulbright Specialist roster. In today's SCR Connection, Dr. Ravotas will tell us about building health literacy, a team sport. Thank you, Dr. Ravotas, for being our guest speaker this morning, and I will turn everything over to you.
Thank you. I'm happy to be here today. I am located in Kalamazoo, Michigan, where I do some of those things that we had just talked about. So today we're going to talk a little bit about health literacy and the role of librarians in health literacy. And I have no conflicts of interest here. Nobody's giving me money to say what I'm going to say. So just so that you know that. So let's start with what is health literacy. So here is a definition that's used quite a bit by Parker and Ratson. Basically, it looks at the individual side and the capacity to obtain, process, and understand basic health information, and to make appropriate health decisions. So we know that 50% of the U.S. adults read below an 8th grade level. But unfortunately, patient materials are often written at a 10th grade level or even higher. So this really means that you give somebody patient information and over half of them cannot use that information and act on it at all. So health literacy actually is an individual issue, but it's also a system issue, and it has to do with more than the individual. So the last big literacy survey that we did earlier this decade, there were 77 million adults who had basic or below basic health literacy. The NOW survey basically was the first one that looked at health literacy specifically. And so if you look at the circle side, the pie chart over here, really about half of the people have intermediate literacy, which means that, they understand some information. But if we look at the below basic and the basic literacy, in those areas below basic are people that can't read well enough to understand, for instance, an appointment card. And the basic are a little bit higher than that. But what's really interesting to me here is the idea of proficient literacy. Only 12% of our population actually have proficiency in health literacy. So that means that only 12% of the population is able to really deal with a complex illness like diabetes, cancer, where you're given lots and lots of information. So that's a major issue here. We also know from the NOW study that limited literacy is more common for some people. So it's more common for people without a high school education, for minority groups, and in this case, the minority groups that they looked at were African American, Latinx, and Native Americans. For people in poverty, it's more common for people who are on public assistance, public health care, and for the elderly. We know that individuals that have these lower, that basic or below basic limited health literacy, use health care inconsistently. Well, you can understand that. If you can't, read your appointment card, it's hard to do that. They have more hospitalizations, more emergency room visits. So it becomes, things get worse before they look for help. They make more serious medication errors. Medication itself is quite a challenge for most people. And then they have increased mortality. In other words, when they do get an illness, they die from that illness more than other people. So we know that actually health literacy, limited literacy affects predicts worse health outcomes than many of the other things we look at. But really, when we look at this, the number of people that will have some health literacy challenges at some point in their life is actually every one of us. And this is due to things that we have the specialized terminology of healthcare. So if you have a doctor, for instance, that falls ill in an area that they're not specializing in, they often do not understand the terminology either. So you can have the best education, but the terminology still is specialized to a particular field. The emotional nature of healthcare, how much are people going to understand when they're told they have cancer? That becomes it overclouds things that you would ordinarily understand. And also the differences in culture. So if you have somebody who is coming from another country, for instance, things like pharmacies and how you access healthcare are very different. I work with refugees. I had one group that called an ambulance, and they had no idea that they were going to be stuck with a gigantic bill for an ambulance. I have an example of this myself. I lived in Honduras when my daughter was born, and I went to the doctor. He said, she needs some medicine. I went to the local pharmacy to get the medicine. They gave me a bunch of syringes with the medicine, and I was expected to give my baby, my newborn, shots. And I just kind of stood in the middle of the pharmacy and cried because that's not my area of healthcare. I'm the communication side. So I had never given shots before, and it was quite scary. I really like this diagram of health literacy because it includes that idea, that definition that I showed you earlier is really an individual definition, but it really has a lot to do, how we understand has a lot to do with the complexity of health information. Both demands and complexity of health information have to match that skill and ability of patients for that health literacy to occur here, for that ability to access, to understand, and to act on information. You have to have these equal. But this is where, I skipped a slide here, but this will work. This is where we usually are, that the demands and the complexity of health information really overwhelm us. And the skills and abilities, while this varies from person to person, it's often not enough for the situation of that complexity. And we're not able to access that information. We're not able to understand it, let alone act on it. But where do librarians fit in this? Well, I think librarians fit really everywhere here. Librarians can assist in building those skills and abilities of patients. They also can assist in lowering the complexity of health information. From the background, the skills that librarians have, there's a lot that can be done here. The question, though, is where to start. Where do you start? If you want to be a partner, you want to be an advocate for increasing health literacy. I'm guessing that many of you are doing some of this already. So I know that I'm probably speaking to the choir, but I'm hoping that you can get some ideas out of some of what I'm going to talk about today. So in reality, because that lack of understanding is so rampant, you can really start pretty much anywhere. But I'll give you some ideas where I think are good places. So I think that librarians, of course, provide resources. They're able to help people search out the kind of resources they need to have those resources on hand. That's really important, and to have those plain language resources for people. I also think librarians are great at providing focus, kind of focusing in on the health issues that are important in that community at that time. And then the last thing I think is to build partnerships, to work with other groups in building the kind of partnerships that will increase health literacy for your community. So let's start with providing resources. So I feel like providing resources come in three categories. So one is plain language health resources for patients. And I'm using the term patients here very broadly. We're all patients at some time or another. Somebody might come in for resources and they're not necessarily engaged in their patient role at that time, but they want more information. So I'm still saying they're patients here. And incidentally, I've worked both with patients and with providers. The second thing is health literacy resources for the providers. And I understand that, you know, you're going to have, I have a variety of different librarians from different types of libraries here. So those of you that are in, you know, a hospital or very specifically a medical library are going to have a big role for resources for providers. But those of you who are even in community libraries, you'd be surprised how many providers are still looking for help and trying to figure out how to lower that complexity a little bit. And I have some ideas here for that as well. Then the other thing is providing resources for local programs. And my programs that I've been involved with have to do with literacy programs, but local programs in health settings, local programs in the health department, etc. So let's look closer at these. So if you're looking for plain language health resources for patients, you want to look for, in particularly, things that are written in plain language. Vocabulary below the 6th grade level is a good target. You can even find some that are lower than that. Right now, we do know that the CDC website is you know, most of it is pretty much at this level. So getting information from there is one place in which you can get this, and I'll talk a little bit about some books that, you know, come out of health literacy. I know that some of you know of these things. In our local library, we work with the Literacy Center works with the local library, and they have a section that is particularly at the lowest levels for, you know, people that are learning English or that are learning literacy. You also look for resources that explain the vocabulary of healthcare, the vocabulary of even, I mean, think about COVID, how much vocabulary people are hearing on the news, and trying to figure out, well, what does this mean? A lot of time they're using really specialized vocabulary and trying to find some of this. So I put one kind of thesaurus for health on here, this just plain clear. It's a website that's put out by United Healthcare, and they are always adding new terms and plain language for those terms. Also, another thing that's really helpful are resources that will read out loud for people who don't read well. And you probably are aware of the Kids Health one, but this is, if you're not, this is a large resource that, for instance, somebody, a kid is sick and you want to find information quickly, and you can go there, and if you can't read well, you can turn on the speaker and it will read to you. And it's pretty well organized for people to find things. The other thing I really like about the Kids Health is that it has a section for adolescents so that they can start looking up their own health issues and start, transitioning into dealing with their own health. Here's a couple of plain language health resources from the field of health literacy that you might not be familiar with. The first one is they are actually both from an organization called the Institute for Healthcare Advancement. And over on the left-hand side here is they have an online center called the Health Literacy Solution Center. And they have a depository of health literacy resources. I can tell you they have a mass amount of COVID resources now that are put out by people who work on plain language for literacy. And there are some English language things in there as well. There's things in there in different languages. The other thing in the Health Literacy Solution Center is that they have a listserv, and this is a very active listserv that you can join. Anybody can join, and there's plenty of librarians on this listserv, and you can ask questions. What a librarian question might be, I'm looking for this particular resource for this particular health issue that's in pretty plain language. And people from all over the world could respond to that and say, oh, I have this is good, or they can direct you to something. And of course, there's people in there that are from healthcare side, from the literacy side. There's educators on there, so there's all sorts of questions. Over here on the right-hand side are plain language books that are also from IHA. These are What to Do series. So the first one that was developed is What to Do When Your Child Gets Sick. It's a reference book. They're all written at the 4th grade level. So somebody can open up this reference book and find eczema, for instance, and figure out what to do. It tells you what you can do at home and when it's time to go to the doctor. Since they developed that book, they've come out with a whole series. So there's a dental series, there's a What to Do When You're Expecting, there's a book on adolescent health, there's a book on senior health. It's a nice combination. They're written in a number of different languages, and you can get them bulk, but that's a really nice series. And a good one for people to use. There we go. So now let's talk a little bit about health literacy resources for providers. So these are, again, resources that come out of the health literacy field. But if you're not familiar with them, I think they're a helpful thing to have on hand. Notice that I have links for all of them. The only one that I know that comes in a hardback, it's not even hardback, it's a kit, is the first one. So this AMA, Helping Patients Understand, it is a booklet. It's for doctors on how to increase how they get their information across. And it's for a long time it had CEUs connected to it. I don't know about that anymore. But this link is to a video that's part of this. And it really illustrates, there's a lot of patients in there that talk about their struggle with trying to get health information. But it is directed at doctors to help them understand that sometimes you think your patients understand, but they're not understanding. The second one is the CDC guide. This is basically, again, a listing of resources in health literacy. They have some training materials in here. They have, where you can look up different things. So the health literacy resources at CDC is good. The Universal Precautions Health Literacy Toolkit is set up for medical offices. It takes them through how to look at your office and see if it's friendly for people, literacy friendly. Really, when we're talking about literacy, all of us appreciate plain language, regardless of our reading level. We like to know real plain and clear about our health care. And so it's kind of a universal precaution to have, make sure that you have it that way. So that toolkit, it's massive, it's online, but it has all sorts of links in like 12 different areas that an office can use to increase their literacy-friendly practices. The 10 attributes of the health literate organization is similar to the universal precautions, but it basically is how to put health literacy into your policies, in addition to how to talk to people, what kind of written things and things like that. And the National Action Plan is out about 10 years ago, basically addresses many areas of literacy from education viewpoints, and how we can look at it as a nation, really, and what kind of things. So the National Action Plan is a nice one to look at for what kind of partnerships help to build health literacy. So these are just some ideas for resources for providers. And then providing resources for like local programs. So you can, health literacy often comes under either literacy or it comes under health, right? Literacy and English language programs, of course, are highly involved in health literacy as well. So how can you as librarians support this? So you can provide resources by stocking books, like the books I just showed you about what to do for health, but books that teach health plus literacy or health and English. Here's another curriculum that's online, Florida Literacy. And also you can order the books and have them available, find out who's using what. Sometimes both literacy and English are not taught in a program. So a relative might know that grandpa doesn't read very well and grandpa's embarrassed and he doesn't want to go to a program. So someone else is trying to help him, with the reading. So these can be helpful for individuals as well. And English is the same thing. Particularly refugees, when they come into the country, they are reliant on people that are helping them relocate. They might not have expertise in actually language issues and health issues, but they might be trying to rely on those people, so they're often looking for resources. In addition to the Staying Healthy curriculum, pro-literacy resources is, one of the big resources for literacy issues. And then teacher-to-teacher resources can be a nice thing to have on hand as well. in addition to stocking these kind of things, also libraries certainly can provide space for tutors and small group teaching. And I'm guessing that many of your libraries already do that. The last thing is really to advertise the services. Where in your community do they teach literacy skills? Where do they teach English language skills? This might be as simple as having a poster at the desk that just says, do you know somebody who wants to read better? You can get free services at, and a number or an email or whatever. So going to that next area that libraries can be involved in is that health focus. And again, I'm guessing that many groups are doing this, but providing a health focus, what kind of focus do you do? So is it flu season? Do you need to have things available for the flu? Where do you get your shots? How do you work with flu? Of course, we have COVID now, and libraries can be very helpful with getting out some of that COVID information. Is there a local health risk, something that's happening locally that you need to address? And libraries can be helpful with getting some of that information out, maybe having a separate section for some of that, having announcements, etc. Programs, lending your rooms out for a program. And then there is a health literacy month. I didn't put it on here, but it is in October. So October is a nice month to say, do you understand all your health information? We have some materials that can help you with that, or finding a partnership to celebrate Health Literacy Month. And then the last thing I want to talk about is building partnerships. So libraries are great partners in programs that help with health literacy. I'm going to talk a little bit about the program I'm involved in and how we got there and what kind of partnerships we have had for that. And then give you some ideas and where partners might be available for you. So I see partnerships as kind of layered, that we have many different types of partnerships, and they're there for different reasons. So these are the three types of partnerships that I see as really important in building health literacy programs. So the first one are essential partnerships. So these are partners that kind of have their thumb on the pulse of the community. They're the partners that engage in community planning. They talk about what their services are. So let me give you an example. I'm part of an adult collaborative that is a coalition that has, it's all people that are involved in literacy. This is literacy, not specifically health literacy. But it's a Kalamazoo Literacy Center. We have the colleges there. We have the adult groups for the schools, adult training groups. We have people that are working with refugees. We have people that are working with people that are just coming out of prison. We have a homeless shelter. So in many of these groups, literacy isn't their prime area, but it's big enough an area that we sit together once a month and we talk about who's doing what kind of overlap there is, where the holes are, and we can help to identify needs. Another essential partnership is advisory groups. So these are groups that are encouraging new projects and partnerships in a particular area. And the advisory group that I've been involved in is the university, Western Michigan University, and the Kalamazoo Literacy Council. So they kind of inform each other. what kind of community needs do we have in the Kalamazoo community for literacy, and then what's available at the university? What kind of expertise to help with this? For instance, now we're doing a lot of parenting literacy, because here's these parents that are trying to educate their kids at home. And so a lot of that is happening. So the people from the university have been able to do that. We put on a symposium every year, and we tap into those students that need internships. So we have interns now that are teaching lots of health literacy issues. Another kind of partnership is an organizing partnership. So these are partners that are organizing and implementing a particular program. And I'll show you how we got to our organizing partners in our summer program. And then we have contributing partners. So these are partners that can contribute maybe one or a handful of elements to a program. It's usually supplies, space, volunteers, things like that. They're not at the center of an organizing partnership, but they want to help, and they have certain ways in which they can help. So let's look at these. From the viewpoint of the program that I put together, the essential partners, we're the advisory board that I was just talking about, the university and the literacy center, and then the adult literacy collaborative. Between these two, we could really recognize what are the needs and look at exploring solutions. So one of the needs, for instance, that had been addressed over at the Adult Literacy Collaborative is that we didn't have enough classes in the evening for adults. But so let's talk a little bit about essential partners that might be in your community. Maybe you are an essential partner. Maybe you're part of this kind of partnership. Or maybe you need to think about who has done needs assessment, who's planning in the health area, who's planning in the literacy area. Because remember I said health literacy can fall under either of those. Are there groups who share what they're doing to increase literacy or to increase health? Again, those can be essential partners that really have a good idea of what's needed in the community. So through our essential partners, this is what we saw were the needs. So we had limited English learning programs in the summer. So English language learners have a summer slump if they're not in class as much as school children do. So they go backward a little bit. So trying to figure out how can we fill this gap. We also had community literacy centers that are need to attract learners. So I'm the director of the literacy center at my church, and that's where we were fairly new at the time we put this program together, and we're trying to attract learners, and weren't doing really well with just come here for tutoring. So we were trying to figure out how to do that. We also knew that in the English learning programs, health content was not consistent. It was kind of haphazard. There'd be one lesson on heart attacks, and then, there wouldn't be another health lesson. So there's something a little bit more consistent in programming. And another one that's not on here is we knew that our local refugees were not comfortable in most of the English learning programs. They were learning to trust the resource center for refugees and really wanted to work with people there. But they didn't have the literacy background. So we ended up with organizing partners that basically were the Literacy Council, that Community Literacy Center, and the Refugee Resource Council. And so we put these together for our English Plus Health program. So just a kind of rhetorical question for you to think about. Do you have a health literacy program you would like to organize with the help of a partner? If so, maybe you need some organizing partnerships. The way we started with our organizing partners is we started to look at it and say, okay, what do we need to run this program? And so we made a list, and here's our list. We needed the literacy expertise. We needed the health expertise. So the literacy expertise came from the literacy program. The health expertise came from my background and some of my colleagues at the university. The language learning expertise, that's folded into the Literacy Center in our community. The familiarity with learners is where we really needed that Refugee Resource Council to reach out to the refugees. We needed an approach to challenges and barriers. Well, here's the church. The church was able to give childcare, big barrier, and also we are right on a bus route. So we were able to do that. We actually worked with one of our contributing partners is the bus service that does training for people on how to ride the local buses. We needed space for the program, which we had at the church. Now this year we went online, so we need something completely different. But we need some volunteers or paid staff. Some came from the Literacy Center, from the Refugee Resource Council, and then we had volunteers from the church who did things like they were the receptionist. Our program started the first year with 70 people, and we've had 90 the last few years, including our online year. So we've had a lot of people. So we really needed those receptionists to help direct people, and then they did things like women in the church did snacks for everybody. We needed funding that came equally from the Literacy Center and from the church. The church has a social justice group that funded the child care. And then we needed curriculum, so we kind of pulled on some of that essential partnerships to look for curriculum. Curriculum for the people that have the lowest level of literacy or the lowest English level is difficult to find. And then we needed supplies. Well, we were a little short on this, so everything else we had except for the supplies. So that's when we reached out to our contributing partners. So one of our big partners was our Lifelong Learning Institute. And so basically they contributed money for notebooks and pens and things like that. Kalamazoo is a big pharmaceutical community. And so they contributed things like over-the-counter medication so we could learn how to read directions in over-the-counter medication. We had so much over-the-counter medication that year that we gave it out as prizes for bingo on the last day. Walgreens and Walmart contributed things like thermometers and medicine bottles, medicine measurements, and things like that. So the question then is, what type of partner do you want to be? And you could be a contributing partner in some program and maybe an organizing partner in something else. But keep these in mind. What things do you think would be helpful for you to get involved with to increase health literacy in your community? Now, the last thing I want to talk about is, where do you find partners for these kind of health and literacy projects? Well, some of them are pretty common sense. librarians for sure, hospitals, clinics, public health offices, literacy centers, English language programs. All of those are partners that you come on pretty quickly when you start talking health or literacy. But don't leave out extension programs. So Michigan Extension, and I think other extension programs around the country, have actually health literacy as one of their areas of concern. Head Start organizations reach out to parents. They all have health advisory committees in Head Start, and some of the best health literacy programs. So many years ago already, the state of Kansas, in their Head Start programs, they ran a what to do when your child gets sick, and they used that plain language book that I showed you earlier. And so they used it with the parents in Head Start, and they all got a book, and they had this reference book. Community centers, county centers, township centers, things like that. Colleges and universities, like they said earlier, you get some expertise from colleges and universities. You can also get some interns. And you can have interns that will do things like we have an event promotion degree, or I think it's a minor at Western. And so they come and help you organize all your events. Or you can have somebody who's, in public health that will work on presenting things. We have a pre-Peace Corps program, and they need to work on some education issues with people from different organizations. Well, English language is perfect for that. So interns are a good thing. We have social workers, we have people from literacy that work in these areas, etc. Housing units. We actually have done some work in housing units where we go and present right within the housing units, and many more people come than if you have it somewhere else, and that works well. Health professionals, people that are not even necessarily connected to a particular organization, maybe have their own office. One of the programs we did in a housing unit on health literacy, we had a pediatrician come and talk and did a question and answer session. We had a pharmacist come and was able to tell people that you can ask pharmacists questions. A lot of people were hesitant to do that. We had a librarian come and talk about resources that were helpful. So the health professional group is a good one as well. Prison rehabilitation centers, jails is sometimes they also want some literacy issues programs. Refugee groups, churches, United Way. So there's lots of different places to look for partners. So I'm going to move on and open up for questions, but if you want to put, partners that you've had in the chat along with questions, that would be great, so we can share, partnerships that might be fruitful for all of you. So thank you very much. I'm so glad that I was able to come, and I really respect what librarians do in our communities, and I'm very happy to be here. So please put your questions in the chat. Edward, do you have some questions for me?
Thank you again for that wonderful presentation. If you have any questions, please put them in the chat. Blur stated this was very good and brought new ideas to my mind, and thank you.
Yeah, I think that really the value of something like this is just giving you, prompting ideas, because I'm sure many of you have some things that you're already doing, but sometimes you just hear something a little bit different.
Barbara asks, any ideas for doing this from a distance or online?
Yeah, actually, we just did our summer program online. So we usually start planning for summer in January, and we met a few times and then realized that there was no way this was going to be a summer program on our campus. Yeah, and I can tell you that, it was a challenge. It hurt my brain because you have to think through everything that you do. We were lucky to have a community that's very focused on education, so they were already working on getting people computers and hotspots. So there were a number of places that funded this. So we brought hotspots and computers out to people, and we had to, at a distance, help people who were not used to technology and also did not know much English to help them to get online. So it was a bit of a challenge. We used a lot of children of those people that had a little bit more English and a little more technology. And we used some interpreters. And we actually ended up with more people in our evening class than we did it before. I would have to say, if you do a program online with refugees, in addition to the hotspots and the computers, refugees often live with a lot of people in a small space. So it's a lot of interference. So, and you have to be able to talk, because that's part of learning English. So I would say, headsets would be an important addition to that.
We have another question. What's the best way to approach a pharmacist to do a presentation?
So you could look for like a state pharmacy organization. Pharmacists are quite ahead in health literacy. They've been working at this for a long time. Or just a local pharmacy. You might want to go with a pharmacy that's associated with a federally qualified clinic, because I think that they are often, that built in a little bit more for them. So those are my suggestions. I actually found the pharmacists very interested in working with this.
Yeah. I'm going to read the last two questions. Brian asks, the Now Health Literacy Study is one that gets cited often, though it is a bit older now. Are you familiar with more recent studies, even if they may be smaller in scale?
Yeah, we don't have as many that have, our specific studies on, for instance, understanding prescription labels. There's a lot of studies on that. There are studies that are on understanding particular, like diabetes or working with diabetes and things like that. But the kind of overarching health literacy, the only one that kind of is similar is the PIAC. And the PIAC is a study that's done around the world in different countries on literacy levels. It's not as much specific to health. But it is an older study. It's something we could really use now.
Is there any special strategy to approach a dentist to attract him or her as a partner?
Yeah, so you might want to try the Oral Health Association. I've done some work with our Michigan Oral Health Association. Now, a couple of years ago, I think this was national, but I'm not sure. It might have just been Michigan. Health literacy was one of their areas of focus. And so they might be amenable to that. There is a researcher out of Maryland that does a lot of health literacy work on dental issues. And I'm blocking on her name right now, but I can get that to you.
And the last question, our branch libraries are closed, so I'm interested in libraries that are doing virtual health literacy programs. Do you have any examples?
That libraries specifically are doing virtual health? No, I guess I don't have any examples of that. Our library has been doing, they, support other groups, but I don't have any specific examples of that. There's a lot of stuff that is going on that's not health related, but I don't know of that right now. Also, I see in here that somebody said contact pharmacy schools. Yeah, that's a great idea. In Michigan, Ferris is our pharmacy school, and they're always helpful.
Thank you again for that wonderful presentation, Dr. Ravotas. It was a pleasure to have you with us.
Thank you. I appreciate it.
I'm going to